Mr. Speaker, under current conditions of overcrowding in our system, we cannot manage a major disaster.
That's right.
This is not a responsible or acceptable state of affairs in Alberta. Even opening new beds tomorrow, Mr. Premier, means weeks or months before we have staff to fill those. Will the Premier act immediately to open new beds in Edmonton and Calgary?
The Honourable
Mr. Speaker, we're putting in billions of dollars into infrastructure in health. It's not only in acute care, research facilities, but also in long-term care. You combine that with all of the training, additional training, the number of spaces that we increased in the universities and colleges. And again, let's not just focus on doctors and nurses. There are other allied healthcare providers. We've increased those numbers to provide and support the nurses and doctors that are delivering healthcare in this province. So we've done a lot in the future. And just as a reminder to everyone, here in the province of Alberta, City of Calgary, the new Children's Hospital, 1 bed per child. Also room for the parent. Again, for disease, breaking the chain between disease prevention within the facility. So there's a very good example of the additional investment in infrastructure.
Second official opposition, main question, the Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. In the most vulnerable times of their lives, this government is denying basic human dignity to patients by putting them in hallways or overcrowded co-ed rooms. If my loved one were lying in a hallway somewhere or embarrassed by being in a co-ed room, I would be livid with this government, just as many Albertans who are writing to me. To the Premier, this government is mismanaging health care so badly, even in a province this wealthy, we are cramming patients into a 2-bedroom with 3 or more people. When will you resolve this chaos, Mr. Premier?
Yeah, Honourable the Premier.
Mr. Speaker, back in, it was 1958. I don't want to give away my age because people really know how old I am. But I was in a 6-man ward. I spent a month and a half in that facility, recovering from a broken bone. Today, the same facility, it is co-ed. There are men and there are women in the very same facility being treated just as well as I did many, many years ago as a young lad. The point I'm making is the system is continually changing. It's increasing the scope of service that we deliver to Albertans, the new technology that has, it's amazing. The month and a half that I spent in the hospital today, I would have been in perhaps a couple of days and I've been home convalescent. And more than likely, perhaps healed up better. I'm not quite sure. But that's how health has changed, and that's what we have to keep in mind. We also have a very aging population. This is the glut generation, the baby boomer generation. They'll be retiring in 10 years, putting additional strain. And that's why the billions of dollars spent in healthcare facilities in Alberta.